Hi, Dr. Hsieh. Welcome to a series of QA questions on MFT topics. Thank you for being here today.
Hi, Dr. Rajaei. Thank you for inviting me here today.
Of course. Could you please start with introducing yourself and tell us a little bit about your background?
Sure, sure. My name is Dr. Hsieh, and currently I'm a core faculty member at Alliant International University for our Sacramento campus, and I'm also the clinical training coordinator for there as well. And I currently have a private practice that I work on about a day and a half, about a day a week,
Mm-hmm.
and mostly I work with both Mandarin speaking clients and pornography addiction clients.
Mm-hmm.
And so a little bit about my background. I grew up in Texas and went to the University of Texas at Austin
Mm-hmm.
for my undergrad, and then went to I was a biochemistry, human development, family science major, and then went to Abilene Christian University for my master's in marriage and family therapy,
Mm-hmm.
and started practicing then, and then went on to BYU for my doctorate in marriage and family therapy. And after BYU, ended up here in Sacramento at Alliance.
What a ride. So
Yeah.
interesting. Thank you for sharing that. So,
Mhm.
today we're going to talk about addiction and pornography. As you mentioned, like it's something that you work with. So, could you please, for the start, like tell us a definition of maybe addiction and pornography? When is it like problematic?
Sure, sure. Yeah. So I like to think of pornography addiction as kind of breaking it down to a lot of the process addictions that we know, and the focus is on that addiction piece, right? So
Mm-hmm.
a definition I kind of been thinking about is just the excessive sexual thoughts, desire, urges, or behaviors that can't be controlled and causes some level of distress for either the individual or relationship, or even causes some distress in terms of like finances or other aspects of the individual's life. I know that's it feels like a DSM definition a little bit,
Mm-hmm.
but I think it really works here in the sense
Mm-hmm.
of like the excessive nature of it, the stress that it may cause.
Mm-hmm.
Um, and then kind of how it impacts not just yourself as an individual, but other aspects of your life as well.
Mm-hmm. So can we say like it's about if it's functional or dysfunctional, like
Yeah,
for someone in our
absolutely.
family system?
Yeah, yeah,
Mm-hmm.
I could say that.
Okay, great. Thank you. And then so when we work with couples, sometimes in my experience, couples they have like partners, they have different opinion about pornography. Some people they think that it's okay, some partners, and then the other partner think that it's the same as like infidelity.
Mhm.
What is your perspective on that or your experience?
Yeah, yeah, great question. Majority of the time, you will have if your clients are couples that come into therapy, they will have a difference in opinion in terms of pornography usage
Mm-hmm.
and kind of what constitutes as infidelity and what doesn't. Generally speaking, a lot of when my clients come to me as a couple, there's usually one individual that has convinced a partner that, hey, this is not okay, and we need to get professional help for this. Usually, the partner, the one who is using pornography, has been dealing with it for a long time.
Mm-hmm.
A lot of times stemming from adolescence and sometimes even younger. And it kind of more recently came to light.
Mm-hmm.
Actually, with the pandemic going on, actually that actually came to a light quite frequently
Mm-hmm.
during the pandemic. Had a lot of clients call me about potentially seeing doing therapy. So when back to your original question of when partners have like a difference in opinion of
Mm-hmm.
pornography, um, usually what I can begin to detect is, what is the purpose of therapy? Is it to create change for yourself, the individual, or is it to create change for your partner?
Mm-hmm.
So that part of it is pretty important to talk about first. Oftentimes, I will start the session with the couple, but then also spend some time individually. And frequently, when I am with the partner who is engaging in pornography, using pornography, their tone kind of changes. As a couple, they kind of are in agreement, like, hey, okay, I know I
Mm,
shouldn't do this. This is bad. I know the effects it's having on my partner. But when I have them as an individual, usually that partner, the tone changes to, well, it's something I've been struggling with. This is something I've been, they may not even say struggle. It's
mm,
something that I've been doing for a long time. I feel like everybody does it. And kind of almost like tries to normalize it a little bit.
mm-hmm,
But then we'll go back to, well, I'm doing this because I know the effects that it has on my partner. And there's not a lot of you can say accountability, you can say even kind of change for oneself
mm-hmm,
to what this change means to them.
mm,
So that I feel like that is pretty important to talk about pretty early.
yeah.
So you can even say at the beginning, there's a little bit of discernment
Mm-hmm,
counseling
mm-hmm,
to, hey, is this really what you want to do? Is this
mm-hmm,
really what you want to, the change that you want to create
mm-hmm,
within not only yourself, but not only within the dynamics of a relationship, but within yourself as well.
mm-hmm, mm-hmm. Thank you. Thank you. That is very profound. So I can only imagine, like, because as a therapist, we have our own biases and belief, right? So I can
Mhm.
only imagine, like, if we go to session and let's say they come with this complaint, and we normalize and we have this affirmative kind of like perspective, and we even like define for them that we have functional, dysfunctional, all these different things. Maybe for some people, like the partner who is not happy, they like, oh, okay, if you say so. Is that okay to do as a therapist?
Yeah, I don't typically do that.
Hmm, hmm,
I really let my clients dictate kind of what is okay within the relationship.
hmm,
I have some couples who come to me who say like, as long as I'm getting my needs met within the relationship, if my partner wants to engage in pornography outside, that's fine.
hmm,
They might kind of have specific limits and boundaries in terms of what type of pornography, how much, etc. And then I have some couples who come to me and say, no, it's none of it is okay. Even
hmm,
thinking about it or anything like that is not okay.
hmm,
And or even masturbation without any type of material is not
hmm,
okay.
hmm,
So, I mean, that's a question that we addressed pretty early on of like, hey, what is the relationship with pornography you as a
hmm,
couple want to define within your relationship?
That's awesome. And so I guess like in our clinical practice, we may experience both sides, that couples who are not, one partner is not happy with pornography, and couples who are okay, like they're thinking that this is like exploring sexuality or all these different things.
Uh,
From research, do we know that is there a correlation between pornography and satisfaction in relationship?
Um, I haven't read any research
Mm-hmm,
that can
mm-hmm,
supplant that correlation.
mm-hmm,
But I think it's from my anecdotal experience in
mm-hmm,
working with couples, I think a lot of it is being clear on how they define that relationship. I
mm-hmm,
have some couples who definitely use pornography as a way to, explore their sexuality with each other, but there
mm-hmm,
are very specific rules to, hey, we only watch pornography or sometimes read about pornographic material together.
mm-hmm,
It's something that's done always together, and there's always specific rules about, hey, what things that we're open to, what things, if one partner says no, we're not open to that, that kind of
mm-hmm,
discussion kind of thing. So I think when it comes to incorporating pornography as part of your relationship, there has to be very specific rules that are agreed upon by both
mm-hmm.
partners.
That makes a lot of sense. Thank you. And so, do you feel like culture and stigma play a role in pornography? Because some of the other addictions, like over-exercising, sometimes it seems like finer or okay in some societies and culture, and then pornography, it's not okay. Is there like really like better and worse kind of like type of situation, or how
Mhm.
we decide to work with clients about that?
Yeah, yeah. No, I definitely think there is a stigma there. But I think it's a different type of stigma.
Mm-hmm,
When you're single versus when you're in relationships. And
mm,
there's a gender bias too when it comes to usage of pornography. I'll be honest with you, Dr. Raji. I don't do a lot of research. I don't do a lot of clinical work and doing and working with pornography within the LGBTQ
Mm,
community. So that's one thing I want to preference. That
mm,
is not my area of
mm,
expertise. The majority of clients that I work with are heterosexual
mm,
clients there.
mm,
So yeah.
mm,
And I think with that, there is within relationships, if you are in a committed relationship, there definitely is a stigma of like, hey, if you are using pornography, even if couples agree that pornography is what they want to participate together, there's still this kind of cultural stigma of, well, something must be wrong kind of
mm,
perspective, right?
mm,
But when individuals are when you're single, there that stigma is still there, but it seems to be a little bit more acceptable, especially within the male community, right?
mm,
And with men, it tends to be like, oh, that is kind of that normalization of, well, everybody uses pornography at some point for
mm,
men. And for women, there is kind of even more of a stigma there of like I would even say it's almost like a positive perspective there sometimes.
mm,
And so yeah, there definitely is a stigma, but it changes when you are in committed relationships. So
mm.
that's one thing that I've been really interested in looking at the role of pornography and the stigma there when it comes to what is okay and not okay with as an individual, as single versus in a committed relationship.
Yeah, that's very interesting. I'm a narrative therapist, so I'm just curious, like in working with couples, asking them, what's the messages that you got about this versus, this, and, exploring that aspect with them.
Yeah,
Um,
yeah.
so what are some of the effective therapeutic approaches in working with pornography?
Yeah, yeah. So I'm a marriage and family therapist, so I'm very systemic in the
Mm-hmm,
way that I approach this. And so I look at it from a very systemic perspective of, how is this affecting you, but also how is this affecting your family? How is this affecting your relationship?
mm-hmm,
When I work with individuals who are in committed relationships, we're not just working on the pornography addiction, but we're also
mm-hmm,
working on the couple's level of intimacy, their sex life, and how they're expressing themselves sexually.
mm-hmm,
And so it's very important to also look at that because what we're trying to do is we're trying to, if the goal of for the couple is to move pornography out of their relationship and it has no role in their relationship, it's very much about there's almost like a competition there. And a lot of my clients have kind of said like when their pornography usage is high, when it's kind of the secretive, thing that they do, their, sex life with their partner typically is lower, relatively
mm-hmm,
speaking.
mm-hmm,
So what we're trying to do is, having higher satisfaction in terms of intimacy, and couples define intimacy in very, very different ways,
mm-hmm,
and so increasing intimacy to kind of place out the use of pornography. So very much a systemic approach in that way,
mm-hmm,
and to look at what I also like to do in terms of like approaches is look
mm-hmm,
at the internal and the external of what pornography usage is,
mm-hmm,
and how to find value
mm-hmm,
um, internally for the things that you're trying to do externally. So for example, what is the value of giving up pornography? What does that mean to you as an individual, that you're doing this?
mm-hmm,
So because when it comes to a lot of different like process addictions, you want to make sure that you're helping your clients finding meaning for the things that they're trying to do and give up, and even if it's little things, right? So one of my clients from a long time ago, talks about how whenever one of the strategies that he implements is he goes to a lot of sporting events, and sporting events has cheerleaders,
mm-hmm,
and that typically is a trigger for him.
mm-hmm,
And so he would, every time he kind of know like a cheerleader performance would happen or something like that, he would get up and go to the bathroom or go to the concession or something like that. Because to him, like the meaning for him, not only is he avoiding a trigger, but the meaning for him is he's trying to create strength within himself.
Mm,
He's trying to, whenever he does that, he would kind of tell himself, like, hey, this is me being strong. This is me kind
mm,
of exercising, like building my muscles there, essentially,
mm,
right? So what he's doing is he's taking kind of the external, kind of taking what's happening around him externally, and creating internal barriers to build himself and build his
mm,
own self-worth and his self-image there.
mhm,
So a lot of times we do things such as like vision boards.
mhm,
How does create that vision for who you are, and what this would mean for you to be a person without pornography in your
mhm,
life. So that becomes like an external vision, external symbol that we can internalize and find value within ourselves.
Thank you.
Yeah.
Very helpful. Makes a lot of sense. So, from your perspective and in your experience, it's not like that we say pornography and then after that we say, I don't know, narrative therapy or solution focused or one of these theories. Like sometimes we say trauma and then after that it's like EMDR, right? It is not like that for pornography.
I don't think so.
Mm-hmm.
I think that you can adapt kind of some key techniques when
Mm-hmm.
working with pornography with any theory that you work with.
Mm-hmm.
I myself, I'm a internal family systems therapist, and coupled with some attachment theory. So get back to the concept of the core self and kind of working with polarizing parts. I very much use that as the process of my therapy.
Mm-hmm.
And then some of the approaches that we do as therapists and working with pornography just helps our clients be able to kind of do things and see the change that they're creating.
Mm-hmm.
I'm a firm believer that in homework,
Mm-hmm.
probably because I'm a professor as well. Homework to me is important, and so giving clients homework to do, and the point of me giving homework is for them to do something and hopefully see change that's happening because of what they're doing,
Mm-hmm.
rather than just processing kind of what we're talking about once a week for an hour. I want to see that change out in their daily life as well.
And keep them accountable. Yeah, that makes
Mhm.
perfect sense. So in your clinical research and in your clinical work and also research, do you see or have you seen anything that surprised you or challenged you about working with pornography?
Yeah, it's one of the I would say maybe one of the surprising things, we can go there first, is still like how little couples talk about sex.
Yeah.
How little they talk about. I mean, if you sex is one of the more vulnerable things that we do. A lot of times, people are physically naked and also feel emotionally naked as well. Sometimes the sex.
Mm-hmm.
Yet, the majority of my couples do not talk about sex.
Mm-hmm.
They really don't talk about their own sexual desires, what they do like about sex and what they don't like about sex. And I
Mm-hmm.
think, unfortunately, that's why some of my clients turn to pornography. Is there's maybe these sexual fantasies that my clients have, or things that they want in sex that they don't talk about with their partner,
Mm-hmm.
because they feel like it's shameful, or
Yeah.
it's something that they shouldn't want, and then so they turn to pornography for it, and
Mm-hmm.
it becomes and it kind of creates some type of fracture within their relationship, because then their sexual journey that
Mm-hmm.
they're on is a little bit fragmented. They're going in different directions.
Yeah. Mm-hmm.
So that's one thing that's I guess surprised me when I first started working with pornography addiction clients, but I've consistently seen it as something that's happened.
Yeah, that is very true.
Mhm.
There are one or two things that also, surprised me sometimes in working with couples about like this topic. That one of them is I think that we are so used to being shamed
Mhm.
that sometimes when we talk about all these different things and the therapist has
Yeah.
affirmative perspective and we don't go like, oh my God, really? So then the couples are like, it's interesting that you didn't have that like big reaction to what we are
Mhm.
telling you. And I'm like, yeah,
Mhm.
we're here to explore it together. So that's
Yeah.
one thing that is always interesting to me. And the other thing is sometimes, not all the time, but sometimes when we talk about pornography, open relationships, those kinds of topics, it's interesting that in conversations that we explore those things, we end up with this conclusion that whatever is going on, it's okay for the couple. It's not okay for the society. And then
Mhm.
the
Mhm.
couples, they're afraid of like society's, friends, family's reaction. And that's the
Mhm.
problem, not the issue. Yeah.
Yeah, yeah, and but in some ways, I kind of agree with couples of like, hey, that doesn't have to necessarily be something that you share outside of your
Hmm.
relationship.
Yeah.
I mean, it's very intimate. It is very kind of,
Hmm.
it's for the most part should stick between
Hmm.
you and your partner there. Yeah.
Exactly. Yeah, exactly.
And
Thank you.
earlier, Dr. Raji, you had said, something that's challenging.
Hmm.
And you mentioned shame.
Hmm.
Shame, as we know, it's something that's very, very difficult to work with. And it just affects people in very detrimental ways. So yeah, a lot of times, you know, working within the couple, one of the challenging things is to kind of making sure the partner who does not engage in pornography doesn't come approach the partner in kind of a shame-based perspective.
Hmm.
That can be really hard because the partner who doesn't engage in pornography, I mean, there's a lot of hurt, there's a lot of pain. The research has shown pornography usage is very similar. The effects of it is similar to infidelity on the partner.
Hmm.
So there definitely is that. So, having to really work with the shame, but and the shame coming from the partner has sometimes been a challenge. And sometimes you have to work with that hurt and pain first
Hmm.
to kind of decrease the voice of the shame by the partner.
Yeah. And sometimes that seems easy. It is not easy at all. So thank you for
Yeah,
mentioning that.
yeah.
Yeah. So what is your piece of advice for students or therapists who want to work with pornography addiction?
Okay, yeah. So I would say, kind of going on that kind of theme of shame, like be aware of
Hmm.
that.
Hmm.
Be mindful of the environment that you're working with within the therapeutic room, because if there is that kind of shame-based atmosphere, it is going to be very hard for the partner who uses pornography to open up more about pornography usage. And
Hmm.
generally, what I have seen is that they only talk about so much of it, and
Hmm.
that with all with these types of things, you want to help clients to kind of disclose as much as possible early on. And if it's a shame-based environment, it could kind of it may not all come out all at once. It might be slower and kind of and then it kind of creates more distrust
Yeah.
within the couple
Hmm.
system.
Hmm.
um I would also say, you as a therapist, kind of that self-therapist work, being comfortable talking about pornography, talking about sex, masturbation, and things like that. Like, and because we as therapists, we don't want to, be part of that shame, right? We don't want to be
Hmm.
when our clients say something that they might watch, we don't want to kind of show the face of like disgust. We want to be come from a non-judgmental piece. We want to be safe, right?
Hmm. Hmm.
um so we do want to make sure that we ourselves are comfortable with those things.
Hmm.
And so that a lot of times it takes a lot of my own work, because a lot of things that my clients engage in or fantasize about, I may not agree with,
Hmm.
but if I come from a place of judgment, it's going to close them off, it's going to shut them off. So
Exactly. Yeah. And a lot of times, not a lot of times, but sometimes in supervision, I see that students, when they want to ask questions around, sex life in general, it goes like, um, you were telling me about um bad thing.
Mhm.
So, so yeah, then we have this conversation that you need to be comfortable with talking about these things. Otherwise, your clients, they're going to be uncomfortable
Yeah,
as well.
yeah, absolutely. And I wasn't, and for me, I was not always comfortable,
Mm-mm.
talking about sex. And I really had to kind of work on myself there.
Mm-hmm.
Because I found early on in my career when I was still like a student, and my clients talk about sex, especially older clients. I mean, at this point, when I first started doing therapy, I think I might have been 23 years old. And some of my clients were way older, um,
Mm-hmm.
and maybe even like 50, 60. I think at one point I had a 70-year-old client when we were talking about sex, and to me, like there was a part of me that just didn't feel like I was adequate or equipped to
Mm-hmm.
help.
Mm-hmm.
So then that kind of imposter syndrome, those questions definitely do come up for yourself.
Yeah, exactly. But I also seen like that like in times that clients are uncomfortable, when I am comfortable and when I
Mhm.
talk about things, they immediately like goes to, talking about it. So I
Yeah.
think that's very powerful and we need to pay attention to that.
Yeah, absolutely. Words are so important, Dr. Raji. I'm so glad you mentioned that. Like, I'm very open in my first session and let my clients know about the process. And I'll say the words. I'll
Mm.
say, I'll first 5 minutes, I'll throw the word masturbation out there, and some of my clients are like, "Oh, he said it." I'm like, "Yes, I did." So kind of working with kind of us, kind of creating that atmosphere where like, hey,
Yeah,
these words are okay.
yeah.
It's okay to say it.
Hmm.
Because I know you know the words, and I know you use the words as well. So
Hmm.
yeah.
Hmm. Yeah, very important. Thank you. I have one last question for you that I ask all of my guests. So, what is one thing that you would tell the younger version of yourself, maybe when you was an MFT student, about becoming a therapist?
Okay. Um, I want to say two things. One is I think so often as therapists we're so quick to like move on and like, okay, my clients are in pain, let's heal it, let's find ways to heal, let's heal, let's heal, let's heal, let's fix. And like, I would go back and tell my younger self and like, hey, sit with that pain a little bit, sit with that struggle a little bit longer, and if
Mm-hmm.
you feel like you've already sit with it long enough, just sit with it even a little bit longer than that.
Hmm.
Because I think this is a slow process.
Hmm.
And sometimes we, as a clinician, we're at a much faster pace than our clients. And the healing process should be a little bit slower as well. And if we move on too quick, if we try to focus too much on healing too quickly, focus on fixing things too quickly, sometimes we don't really fully grasp the pain that our clients are going through or feeling, and that can be harmful in that we don't necessarily address it, or maybe our clients don't feel like that we're quite understanding them. So I think now I sit with my clients more with their struggles versus kind of when I was younger therapists.
Hmm.
And I felt kind of we've built a lot stronger therapeutic relationship because of that.
Yeah.
Yeah. So that's the first thing. And then second thing, I actually, just thought about this last week because we were talking about it in one of my classes,
Hmm.
my practicum classes with some students, is the idea of like spirituality and religion. I think sometimes therapists, we don't talk about it. We try to avoid it, but it can be a key tool for our clients if that's what they subscribe to. I work with a lot of clients from different spiritual backgrounds, but more often than not, their internal strength and how they overcome something like pornography has some roots in spirituality.
Hmm.
And the more we can use that as a tool to help our clients heal, help our clients build themselves,
Hmm.
the more it's going to stick with them, because that's a lot of times where they put their self-worth, they put their hope, is in their spiritual parts there.
Hmm. Hmm. That makes a lot of sense because at the end of the day, it's about the meaning making system that we have, right? How we make meanings out of the story of life, illness, recovery, trauma, addiction, all these different things. So yeah, thank you so much. Appreciate it a lot. Thank you for your time, Dr. Hsieh. I know that you're so busy. Thank you, and thank you for being here.
Yeah, thank you so much, Dr. Rajaei, for inviting me. I actually I actually randomly tapped into like one of your series a few weeks back. And so like and then actually after that, like a few weeks later, a couple weeks later, you emailed me. So I thought this was a great so yeah. Thank
Thank
you.
you. I appreciate it. Have a great day.
All right, you too. Bye bye.
Bye.